Hi guys, I'm Dr. Haley Overstreet with Aspire Allergy and Sinus. We're going to play a little game today and see how bad your sinus and allergy symptoms really are. So we're going to take the sinonasal outcome test today. We call it the SNOT, which is appropriately named. It's called the SNOT-20. We use this test to determine how bad your sinus disease is and or allergies, because they do like to work together. Some people get so used to just living with these symptoms, they just feel like that's their norm, and it's not normal. So we want to make sure that you are recognizing it so that you know if you need to be seen by someone. So I'm going to list a series of symptoms and you're going to rank them on a scale of 0 through 5. 0 means it's not a problem at all. 1 means it's a mild issue. 2, a mild or slight problem. 3, a moderate problem. 4, severe. And 5, it's as bad as it can be. So you're going to keep track of your answers because we're going to add them up at the end and kind of talk about what that score means. So starting with our symptoms, first one is need to blow your nose. Next one, sneezing, runny nose, cough, postnasal drainage, or that mucus going down the back of the throat, thick nasal discharge, so that's coming out the nose, earfulness, dizziness, ear pain, facial pain and pressure, difficulty falling asleep, waking up at night with symptoms, lack of sleep, waking up tired, fatigue, reduced productivity, reduced concentration, increased irritability or you're restless, increased sadness or depression, and finally nasal congestion. All right, so add all of those up based on 0 to 5, 0 being not a problem at all, 5 being as bad as it can be. Now let's look at those results. If you scored 0 to 10 points, that means that you probably don't have an issue. You're good to take an occasional medication over the counter. If you scored the 11 to 40 points, that means that there's a little bit of a problem there, and it actually may benefit you to come and see myself or one of my partners, because we can do additional testing or maybe even give you some additional medications that aren't over the counter. If you scored 41 to 69, that's a moderate to severe problem, meaning that you are probably experiencing sinus and or allergy symptoms at least a few months out of the year, if not more. And it's definitely recommended that you make an appointment so that we can do additional evaluations for that. And then if you scored 70 to 100, then you definitely need to come and see us. That means that you probably have severe sinus disease and or allergies. Again, they do work together, and we can definitely help you to feel better. We can do allergy testing, we can evaluate your sinuses, and we can even help do sinus procedures if needed. I hope that was helpful for you guys. If you have any questions, please feel free to comment.